of Mpox. Authorities confirmed the patient is a European man who had recently traveled to Thailand from an African country. The 66-year-old landed in Bangkok on the 14th of August on a connecting flight from the Middle East. He was sent to the hospital with Mpox symptoms the following morning. Lab tests are underway to determine the strain. The result is expected by Friday. Officials believe it to be the clade 1, that's the more dangerous variant, as an initial test suggests the man does not have clade 2. He has been quarantined in a hospital since testing positive. Health officials are monitoring some 40 people who came into close contact with this patient. Mpox, previously known as monkeypox, first rose to recognition during a global outbreak in 2022. This disease spreads predominantly through close physical contact. Those infected could experience fever, aches, and large boil-like skin lesions. This disease has affected nations across the globe, including those in Asia. Since the start of the year, some 600 cases of Mpox have been confirmed in the region, but they were mostly from the milder clade 2 variant. These include the most recent cases in Pakistan and the Philippines. On Monday, Pakistani authorities gave the reassurance that the Mpox virus that was detected on the 13th of August was not the more transmissible clade 1b variant. The Philippine Health Ministry also reported similar findings after detecting its first case since December in a 33-year-old male who had no recent travel history. The clade 1b variety of Mpox has, though, triggered global concern. That's due to its link to a recent surge in cases and deaths in parts of Africa. Countries in Asia have been ramping up their border screenings to curb its spread. For instance, South Korea will require travelers arriving from affected countries, including Rwanda, Uganda, and Kenya, to report any Mpox symptoms. Epidemic investigation officers and doctors will also be stationed at the arrival gate for those flying in from Ethiopia to respond and to monitor arriving passengers swiftly. Other parts of the region, including China, India, Indonesia, and Malaysia, have also adopted similar measures. Experts, meanwhile, are reiterating that the Mpox situation is less threatening. That's compared to COVID-19, especially as more countries gear up testing, prevention, and treating capabilities. Singapore's health ministry, for one, has maintained that there is a low risk of the latest Mpox variant spreading to the city-state.